Well, good afternoon, everyone. Thank you for being here for this very informative and insightful and enlightening discussion. But before we get started, I'm going to ask that we take a few seconds of silence to honor the spirit and the life of Beth Williams, who worked for Blue Cross Blue Shield over 20 years ago and left Blue Cross and Blue Shield to head up Roxbury Technology after her father passed away suddenly. And she was one of our honorees recently for the most impactful Black women in Boston. Beth passed away suddenly at age 58 this week, and we are all saddened. So let's take a moment to remember this pioneering, generous, philanthropic woman. Thank you for that. So let me give you a little bit of a little housekeeping here. Please feel free to take lots of screenshots and pictures and tweet them out, put them on Facebook, on Twitter, on LinkedIn, Instagram, and use the hashtag health is wealth, excuse me, and GK events. So please feel free to do that. This important topic really came about because, as we know, in the past year, and it has carried on into this week, we know that Derek Chauvin, the police that murdered George Floyd, was sentenced 2 days ago, and for once we all felt a collective release and we exhaled. And then over the last 2 days, 2 more young Black people have been killed at the hands of law enforcement. So last year, the pandemic coupled with the racial reckoning caused all of us to really look at everything going around us and around us with a racial equity lens. And what we saw was frightening, that like a forensic MRI, we really saw not only how the pandemic was impacting BIPOC communities, but how it was doing so disproportionately. And it spotlighted the disparities, both in wealth and in health. Thus, the health is wealth. Many CEOs and their DE&I officers really raised themselves to the occasion, met the moment. Perhaps none more so than Andrew Dreyfus, of the CEO of Blue Cross Blue Shield, and Stephanie Brown, the head of diversity, equity, and inclusion at Blue Cross and Blue Shield. They did a phenomenal job, both internally, recognizing that employees, particularly BIPOC employees, and especially Black employees, were impacted, were traumatized by what was going on. And they did a phenomenal job, both internally addressing the trauma and the issues. And then, as a healthcare company, they looked externally and said, how do we as a company really begin to address the issues of inequity and disparities within our state, within our footprint, so that we can really lead by example. And I am very proud to say that Blue Cross and Blue Shield is a founding corporate partner of Get Konnected. They have been with us for 13 years, and they continue to raise the bar and to do a phenomenal job. So today, you are going to get the best of the best. We are joined by the DE&I leadership from Blue Cross Blue Shield, which is the largest insurance plan in Massachusetts. And we'll be discussing the role that Blue Cross Blue Shield of Massachusetts have played in response to COVID-19. They will review their company's journey, how they got here, and they will discuss how their focus has pivoted and their impact on health equity within our community. So let me introduce the panel. First, Stephanie Brown, who really is at the forefront of a lot of this under the umbrella of diversity, equity, and inclusion. She is the Vice President and DE&I officer. She is more or less the recipient, most recently, of one of Get Konnected's most impactful Black women, and also one of the most influential people of color. In 2020, she was a top influential woman in diversity, and 2019, she was the Technology Leadership Council Mosaic Award. She previously served as director and executive on the executive board of the Girl Scouts of Eastern Massachusetts. So, and also received a Leading Women's Award. So you get the sense that Stephanie is very involved civically in our community, but more importantly, I would say she is really changing the face of Blue Cross and Blue Shield in terms of making it a more inclusive and diverse company. Mark Freeberg is the SVP and Performance Measurement and Improvement Vice President. He oversees all of that. And I have to say that Blue Cross and Blue Shield is a company that really believe in metrics, because metrics drives how you change things, how you tweak things. And Mark's job is really about overseeing all the activities related to improving and measuring performance of the provider network. He was a former researcher at RAND, where he led multiple projects to measure, evaluate, and improve health systems performance. He's a general internist who provides primary care at Brigham's and Women's Hospital, where he completed his residency and fellowship. He's an MD from Harvard Medical School and an MPP from Harvard Kennedy School of Government and a BA from Swarthmore. Cedric Terrell is a Vice President and Chief Pharmacy Officer. Is Cedric on today? I didn't see him.
Yeah, he'll be here.
He'll be joining us. Okay, he is at Blue Cross Blue Shield. He has served as Senior Vice President and Chief Pharmacy Executive and President Post-Acute Care Network at Novant Health before coming to Blue Cross and Blue Shield. And he too is very involved civically in his community. Maria Fernandez Dominique is the Director of Public Affairs as a community development professional with 15+ years experience in leading and managing complex and high-level programs. Maria brings thoughtfulness and innovation to the intersectional work of grassroots resident leadership development, affordable housing, access to healthcare, equity, and belonging. And she has a proven track record of advancing legislative and budget policy priorities that address system-level needs of low-income communities, and a strong advocate for sustainable partnership and working between corporate, nonprofit stakeholders and diverse community leaders. So we are very proud and very thrilled to have what I call a stellar A1 panel today. So take it, Stephanie.
Thanks, Colette, and thank you so much for giving us the opportunity to talk about the work that we're doing at Blue Cross. And I have been one of your fans for a long time, so I really appreciate this opportunity. I'm going to say we've been experiencing a trifecta pandemic. If you think about COVID and racism being on display, and then the economic crisis that the country has gone through over the last year, it is imperative that the work that we're doing today continue, even though we may think that we have received some blessings over the last few days this year with the trial of the murder of George Floyd. But I would say Blue Cross has been focused on diversity and inclusion for a good little while, and that we actually believe that healthcare is a right, and that everyone should have the opportunity to have high quality, affordable healthcare. We know that a diverse and innovative organization creates a high performing organization and ultimately a more successful organization. When you think about an organization like ours that is 30% people of color, 72% female, with all 5 generations and rolling into 6 generations, all working together to build this inclusive, diverse company that really celebrates and actually embraces the uniqueness of all of our employees and all of our partners in the community. We strive to drive growth and support our core values through that lens. Prior to the pandemic, we had a pillar strategy that encompassed what we call the 4 C's. Commerce, the community, the culture, and career were just the linchpins of how we view diversity through everything from products and services to how we think about our culture, how we recruit, and then the work that we do externally in the community. But post the pandemic, post the murder of George Floyd and the statistics that started to come through around health disparities in plain view, we knew that we had to pivot. The fact that COVID just ripped the Band-Aid off of health disparities really made us really stop and think, what do we need to do differently? And that's when we actually created the new pillar, which we call CARE. We have done a lot of work with the provider community over the last 12, 14 years around care, thinking about a high quality and affordable healthcare. But the direct lens on equity and the direct lens on health disparity was something that we knew we needed to do more. And this is why we're actually talking about this work today. Could we change slides, please? Next slide, please. Thank you. Oh, no, go back, blank. So one of the main things we did when we created our health equity plan early in 2020 was we stopped and took a look at our own internal diversity council. We know that as an ecosystem, where we sit in the ecosystem, we need to make sure that we're accountable both internally and externally. And we always had a diversity inclusion council, but we were purposeful around adding the word equity because we really wanted to make sure folks knew that we were focused both internally and externally around equity, which we always have been, but the word just didn't sit in the name of our diversity organization. And we wanted to make sure that the council really was an example of everyone at the company, meaning all levels of the company and all experiences at the company. And so we expanded our council in the middle of 2020, which is led by Andrew, and really assigned all of those 5 pillars to specific senior leaders across the organization, so that we were focused on not only just the work, but also the metrics of the work, and that there were multiple folks who could lean in and actually help with developing the engagements that we were going to work on. Next slide, please. So not only did we know that we needed to do this work internally, we also knew that in order to be accountable to the market, accountable to our members, accountable to the community, we really also needed a bench of support from the external side of diversity, equity, and inclusion. And so we created our Health Equity Council, which is led by Mark Friedberg and Andrew. But what we really wanted to do is make sure that we had folks from all walks of the healthcare space, as well as our customers, and as well as the social side of our community, to help us really understand what were we putting in place inside that was going to help us identify and manage to the impact of what we could do around health disparities, but also provide insight into the work that had already been done around health disparities in society. We knew that, and we know that it obviously is not enough, and that we definitely have to pivot, but we hope that these leaders will not only bring their voice to the table, but their organizations and others along the way. So I'm going to pivot over to Mark and let him talk about the work that we're doing on health disparities. But I just want to say that, we are focused on making sure that both internally as well as with our foundation, that we are going to somehow or another eradicate health disparities, at least within the community of the members that we serve and our community in Massachusetts. So I'll turn this over to Mark, and he'll talk a little bit about the Care C.
Thank you, Stephanie. Let's go to the next slide. I want to thank Get Konnected for the opportunity to present to this group. So just a little bit of detail about the data we're collecting. And I'll say that what we're trying to do as far as improving the equity of healthcare among our members and the communities that we serve rests very heavily on measurement. Measurement is critical to understanding where we have inequities, the relative magnitude of those inequities and how important they are, and critically to holding ourselves accountable over time for making measurable progress towards reducing and eventually eliminating those inequities in health and healthcare. Right out of the gate, as a health plan, we face a problem that's fairly common in the industry, which is that we don't have almost any gold standard race and ethnicity information for our members. And what we mean by gold standard is how members self-identify. So we're taking race and ethnicity as social constructs, and how members self-identify their own race and ethnicity is what we consider to be the gold standard. If we don't have that information, it's very hard to then calculate and measure inequities on any performance measure, whether that's a measure of technical quality, like whether people are getting their cancer screenings as recommended, chronic disease management, whether blood pressures and glucose control are in control the same amount for our members of different races and ethnicities. All of that's very hard to observe if we don't have the information. So we started at the end of 2020 on the first of a series of planned efforts to gather large amounts of this information from our members. And the first foray into this is through our MyBlue app. And this is where these screenshots come from. We have if you're a Blue Cross member and you log in for the first time after this went live, you'll get a pop-up that says, "We need your help," and asks our members to take 1 minute to tell us their race, ethnicity, and language. It then pops over to a set of race and ethnicity categories that are drawn from the federal government. These are also what appears on the US Census, so they should look familiar to folks. We don't consider these to be perfect or the final endpoint for data collection, but we need to start somewhere, and this seemed like a good place to start. A little information about why we're asking, and then on the right there, you can see how this imaginary patient, imaginary member John Sample, recorded his race and ethnicity information. When we went live with this, we weren't sure what the uptick was going to be like or what we might hear back from our members. And it's gone, I think, a little bit better than we had expected. So as of about 3 weeks ago, we had over 300,000 unique views of this pop-up. And almost 100,000 members, so about 95,000 members, have already provided their race and ethnicity information. Over 23,000, or about 25%, are members of color. And of those 315,000 members who saw the pop-up, we've only had one member complaint so far. And the complaint was that we didn't have enough categories of Asian race, which I think is a completely legitimate complaint and something we aim to address in future data collection efforts that will offer more detail in terms of the categories that people can choose from. Let's go to the next slide. Here's a little bit more information about the pace of data collection and some, I think, interesting and unanticipated things we've observed about it. So the data collection peaked at about 10,000 members telling us their race and ethnicity in January of 2021, and we sort of expected that peak to occur then because our biggest month for MyBlue is January of every calendar year, as new members log on for the first time and look around the site and look for things that they need to see. About 30% of members respond and fill out that information the first time they log into MyBlue. If they don't respond, because most people aren't coming to MyBlue just to give us their race and ethnicity information, they may want to look at aspects of their insurance policy, search for a provider, many other things. The remaining 70% just cancel out and go about their business. But they will have an opportunity in the future. That pop-up will come back after a snooze of about 2 months for members to, offering them, again, the opportunity to input that information. One thing we've observed that we didn't anticipate was that as best we can estimate, the response rates of filling out that survey are higher among our members of color. So higher among our Asian and Pacific Islander members, our Black members, and our Hispanic members than among our white and non-Hispanic members. We don't know the reasons for that, but it's an interesting observation. Because only about a third of our members, so about 1 million out of our 3 million members, are on MyBlue, we'll be looking at other ways of gathering this data later in 2021. So in the summer and fall, we'll be deploying mail, telephone, and other ways of gathering the information, both for members who are on MyBlue and have not yet given us the information, and of course, those who have not gotten onto MyBlue yet. And I think I'll turn it over now to Cedric.
Hey, thank you, Mark. If we could go to the next slide, please. And Mark and Stephanie and Colette, thank you so much for the opportunity to talk a little bit around the pharmacist role in COVID vaccinations as well as health equities. I think if we really take a step back and look at the forest for the trees, we see that pharmacists are interwoven in the community as a pivotal role. And if you think about healthcare, there are episodes where you have acute medical management needs, or you have chronic needs that you have routine visits to your primary care. But there is a staple in our community, in our communities, where the pharmacist role, on a typical basis, most people will encounter or visit their local pharmacy anywhere from 10 to 12 times a year, if not more. And so what we know for sure is pharmacists play a significant role in our communities in healthcare, and they're central partners of the healthcare team. They are frontline caregivers. In my experience, I've led some pharmacy teams where social determinants of health, even though we realize that social determinants of health when it comes to healthcare, it's less than 10% of the overall need that we have in really pursuing health equity. It is a pivotal role, and our pharmacists have a huge role to play in that. The COVID vaccination really highlights that from the federal government and state government standpoint, while for a large part, engaging with our national retail chains and our independent pharmacies to ensure that we have vaccine sites and the ability to provide vaccine for our communities. With more than 60,000 pharmacies in the community, 90% of people, they live within 5 miles of pharmacies. Now, the part that we know is still true, it depends on the community and it depends on the state that you live in. There is a such thing as pharmacy deserts. And so one of the roles that one of the initiatives that I am so passionate about and partnering with our retail chains on is really unpacking this and finding a way that we can collaborate and ensure that everyone has equal access to vaccination programs, chronic disease management programs, as my role is part of Blue Cross Blue Shield. Earlier this week, me and my colleague, Dr. Catherine Dallow, we had a great conversation with one of our pharmacy network retail chains, Walgreens, and we are now exploring how we can partner to bring vaccines to people's front door, especially in areas where there hasn't been enough vaccination penetration, especially in our Massachusetts market. And then the role of the pharmacist in the care delivery model, where they be integrated delivery and so forth, working as part of a physician's team, providing services and helping patients, and especially helping Blue Cross Blue Shield members get better control of their chronic diseases like diabetes and better management. We're definitely exploring those throughout Blue Cross Blue Shield as we continue to move forward. The piece that I'll leave you with is, when we talk about care delivery, data, there's copious amounts of data that show the role that pharmacists, nurse practitioners, physicians assistants, if you will, are partnering with physicians in collaborative practice agreements. And people that are engaged with pharmacists on a routine basis, they're 8 times more likely to be better managed or controlled once they're diagnosed by their primary care provider, and then from there facilitated for appropriate use of their medications. So we know the data is there. And at Blue Cross Blue Shield, we're so passionate around getting people the resources and getting people connected in the right way that best helps them manage their physical or medical ailments. I think from here, I'm going to pass it over to Dominique so we can talk about some of our values at Blue Cross Blue Shield and the shift that we're making to this important work around DEI.
Thank you so much, Cedric. Good afternoon, everyone. My name is Maria Fernandez Dominique, and as Colette said, I serve as the Director of Public Affairs, working within the Blue Cross Blue Shield Corporate Citizenship team. And I'm going to take the next 5 minutes to give you an understanding of what our team looks like, tell you the story of how we've evolved our healthy living strategy to a healthy health justice strategy, and give you a clear understanding of how we have supported the many community-based organizations that have worked around COVID-19 testing and vaccine. So the slide that you see here is of our corporate citizenship team. Our main work is to sustain Blue Cross's strong brand and reputation in the community through community investments, volunteerism, environmental sustainability activities, and outreach to community partners. Since 2014, our efforts have been guided by our deep commitment to helping our members and all Mass residents lead their healthiest lives. By focusing on healthy eating, active lifestyle, and healthy environments, we have worked to influence behavior change and make a lasting impact on every person that we reach and work with. The COVID-19 pandemic and the ongoing fight for racial justice have laid bare the deep racial and ethnic disparities that exist in our healthcare system. With the urgency brought on by these dual crises, our team was compelled to revisit our healthy living strategy to affirm our approach moving forward. Next slide, please, Christina. Through internal focus groups and consultation with external stakeholders, we realized that we needed to put a more intentional focus on racial equity and to acknowledge the barriers to healthy living. This resulted in a reframing of our approach as health justice. What does this mean? This means that moving forward, we will apply a health equity lens to our work. We'll emphasize the historic and present day injustice that contribute to desperate health outcomes. We will prioritize partnerships, initiatives, and funding opportunities that enable us to co-create systems and conditions with our community partners that will improve life chances, outcomes, and successes for the most underserved in our Commonwealth. Next slide, please, Christina. In addition to healthy eating and active lifestyle, the health justice approach will now include a focus area on environmental justice and racial justice. We were intentional in calling out racial justice as its own focus area. This was very, very important to our internal and external stakeholders. We say racial justice instead of racial equity because justice really gets at the system levels work that we want to promote and advance. The focus area on environmental justice is exciting as it gives us the opportunity to evolve our work from the built environment to quality of housing, environmental conditions, and infrastructure. This work will be done in parallel with our 5-year sustainability strategic plan. How we refer to these focus areas will continue to evolve as we build out our goals for each. Next slide, please, Christina. Now that I've provided you with an understanding of this new approach guiding our work, I want to focus your attention on our COVID-19 specific initiatives. We recognize the hard work of those at the forefront addressing the many challenges of COVID-19 and racial inequity. As such, we have invested heavily in uplifting their work. A few examples include a $1 million grant to the new Commonwealth Racial Equity and Social Justice Fund, $1 million partnership with the Mass League of Community Health Centers to address transportation needs in underserved communities, $350,000 racial equity and justice grant funding to 8 BIPOC-led community-based organizations, $125,000 support to firefighters and teachers to aid in their health, mental health and wellness, and sponsorship of the Black Boston COVID-19 Coalition to assist in their efforts for equity in COVID-19 testing and vaccination. Next slide, please, Christina. We thank you so very much to Colette and her team for convening this conversation. We're very thankful to each of you for taking the time out of your very busy schedule to give us the opportunity to illustrate our DE&I journey and our impact on equity and community engagement. We look forward to taking your questions and getting your input. And now I'll kick it over to Christina to assist us in the Q&A. Thank you very much.
Awesome, thank you so much, Maria. So first question from Kevin for Dr. Friedberg. Impressive response to our query to members. Is this nationwide or just Massachusetts?
Yeah, it's a great question. The answer is it's nationwide. So we're trying to collect this information on our members anywhere they live, and our My Blue app is available to our members in all states. Thank you.
Thanks, Mark. Cedric, we have a question from Shannon in regards to the approval of vaccines. How will the FDA approve vaccines once the FDA emergency use authorization expires?
For some reason, we can't hear you, Cedric.
Thank you, Stephanie. I double muted myself. I think that's a great question. What we saw was unprecedented in regards to emergency use authorization for investigational therapies throughout the pandemic, and now that we're moving into post-pandemic and restyle endemic phase for COVID, I think what we'll see is the usual and customary practice where the FDA reviews the safety profiles of vaccines as we move forward. Of course, we've all recently seen the pull on the J&J vaccine because of some limited but still surveillance, post-marketing surveillance on blood clots that were found in women above the age of 40. And so I think we'll still see that surveillance, and it's always been there, post-marketing surveillance as vaccines make their way to the market. But I think Dr. Anthony Fauci also mentioned earlier this week that it won't be long that we'll probably see the J&J vaccine come back on the market. But it shows you the level of scrutiny that vaccines are going through in this unprecedented time.
Thank you. So I dropped in the chat if anyone else had any questions at this time that they would like to drop in the Q&A.
Christina, I would also share a little bit more about kind of what we're doing inside to make our organization a culturally competent organization.
Perfect.
I think that as you see, all the work that we're doing across all the pillars really require us to be culturally competent. If you think about our member-facing organization is somewhere around 1,000 employees. And over the last year, we have spent time with making sure that they all go through a culturally competent unconscious bias training that we partner with Quality Interactions to make sure that as we begin to roll out work around health disparities, that we're comfortable, that our members will be comfortable having those conversations with our associates, as well as thinking about internally, how do we create a culture of unconscious bias, peer-to-peer and employee to employee. One of the other things that we've done with the organization is really taking a hard look at making sure that we ground the whole organization on what is systemic racism. And our organization has gone through what we call a 21-day habit immersion training around systemic racism, where we are walking them through examples of both social injustice as well as healthcare injustice as it relates to the work that we do, so that they really understand no matter what role you're in the organization, you understand the impact that racism has had on the healthcare of the community at large. So that has really helped us have a lot more people at the table talking about how do we create interventions and engagements to root out both racism as it relates to policy, but also racism as it relates to healthcare disparities.
Thanks, Stephanie. We have quite a few more questions coming in. Mark, one of the questions, are all of the Blues nationwide doing these member queries?
No, I believe we're one of the first to do this. I don't think we're the only Blue nationwide to do this, but it's relatively uncommon among health plans in general.
Great. And Cedric, how are you addressing vaccination hesitancy culturally? Is there more of a doubling down on the hesitancy given the J&J issue?
That's a great question. Personally, I'm engaging with individuals daily, reiterating the importance of vaccination not only for your safety, but for the safety of those you love. I've recently I lost a very close friend that was hesitant on vaccinations, and it truly rattled me to the core. and it was a lifelong friendship. So, and the second part to that, I would say, is at Blue Cross Blue Shield, we're engaging in those conversations daily. I think the platform from our DEI work and how we've created a safe place to just have open dialogue around the cultural diversity and the hesitancy that has existed. We acknowledged that from the very beginning when we knew the vaccines were coming to the market, and we started really engaging in those conversations. And I think it's making a difference, but there is hesitancy still out there. We're all human. I just spoke with a colleague earlier today, and it was her first time getting any type of vaccine, because she knew the significant value it brought to her family and her loved ones. And so she decided to get the vaccination. And on her first vaccination, she had she got some of the symptoms of the vaccine, but still she's standing with it, and she's very proud of her actions she's taken. And then lastly, for the J&J vaccine, I was one of those that got the J&J vaccine. I haven't experienced any side effects from it, but I have truly, advocated and supported my family members in getting the vaccination as well. And we've had some of our family that has been hesitant in prior years of getting flu vaccine and so forth and so on. So I think it behooves each of us to speak from a space of love and authenticity, and encouraging all of us to consider vaccination.
Thank you.
Maria, you want to talk?
Sure.
I say if Maria wanted to add in on that one.
I would love to. Thank you. I want to co-sign everything that Cedric has said. And in addition, I want to say that on the corporate citizenship side, we have been intentional about supporting community partners to be the ones to address the hesitancy, right? Because as much good work as we do in the community, we are part of the healthcare system, and in some ways have been complicit in the inequities that have happened in the system, right? So we took an intentional effort around having them be at the forefront and giving us guidance on what support looks like. For instance, as I said before, the Black Boston COVID-19 Coalition, we knew that they were reaching out to folks in the community that are hard to reach. So we said, how can we support your efforts, right? We had two faith-based leaders in the community who were putting together webinars, Reverend Gloria White-Hammond and Reverend Liz Walker. And we supported their efforts with communication because we knew that the community needs to hear this from trusted Black women who happen to be also faith leaders, right? We've also collaborated with local community development corporations, right? So they're expert at building homes, but they really have found themselves being asked questions by their residents around, do I take the vaccine? Where do I get the vaccine? How do I get access to it? So we've had one of our clinicians, Desiree Autenti, lead a webinar with them because we know that they hold portfolios across the Commonwealth and have access to a lot of residents, and really wanted to support their efforts to getting the word out there. We're also helping the Chambers of Commerce. They've put together resources on their websites around COVID-19 testing and vaccine. So we've supported that work in addition. So just wanted to say that we hear and recognize the hesitancy in the community, and we say that this mistrust is earned, and that we have a role in it, and that we have to be intentional about addressing it and letting those that are best equipped to speak on it, to have them be at the forefront, and then we do whatever is necessary to support that.
Such great points, such a team effort to really address this. Thank you. Cedric, would you be able to share more details about your partnership with Walgreens on getting vaccines to the doorstep in the communities?
Make sure I didn't double mute myself again. Yeah, so we're in preliminary phase of that. Like I mentioned earlier, what we're exploring now, we actually acquired insights from another Blues plan through the association and their partnership with their affiliate Rite Aid, and what we realized that Rite Aid is not necessarily the dominant retail pharmacy in our Massachusetts market. And what we decided to do is take some of the outlines of their partnership and look at ways that we could do a similar type of model with our pharmacy network, which is encompassing of Walgreens, CVS, and quite a few independent pharmacies. So our first conversation was Walgreens. They have been very inviting and welcoming to that. We're beginning to launch into really unpacking, what kind of program we can put in place, and then usher the partnership with obviously our donation that we've made to the CHC. So there's more to come. But I thought it was worth us mentioning, our intentionality around ushering those partnerships with the community wherever we can, similar to what Maria called out.
Thanks, Cedric. Let's see, we got quite a few coming in. Mark, do our providers need to certify any verification of cultural sensitivity training as part of their contracting?
No, not currently. That's something we're looking at, but that's not a current requirement for our providers. I want to say a little more about how we're thinking about that issue broadly. So it's one thing for a provider to go through a training and have a certification of some kind that they submit to us. That isn't sort of the end of that discussion, though. From a measurement perspective, we'd really like to know that training worked, and the best people to tell us that are our members. So I think our ultimate way of making a more meaningful assessment there is to ask our members in a structured and systematic and rigorous way to report on how they're being treated by our provider network, and hopefully start to see any inequities that currently exist reduce over time.
Thank you.
No, Mark, you and I have talked about this with our external counsel a fair amount. And one of the things that they brought up early in our conversation was around the opportunity to make sure that people felt like they were having dignified health and get some appointments or engagements with their provider. And we've been really pushing the envelope and pushing, the needle on going, what does that look like? And how would we be able to measure it? Because it's one thing to know that you got good health care and that your symptoms or your disease has been managed appropriately, but it's another thing to actually go through that process and feel like you went through it and got dignified support. So that's one of the areas where we're really kind of thinking about, well, how do we measure that? And we'll continue to explore that over the next year to figure out how that then turns into what we might be doing with our providers.
Thanks, Stephanie. So one of the questions I have for you, Stephanie, says, great to see how much Blue Cross Blue Shield has done and where they're going the rest of 2021 and beyond. They noticed that many of the initiatives involve both internal and external resources and experts. For a company who's not as far along in their DE&I journey, at what point does it make sense to branch out externally?
Well, that's a broad question. Yeah. I think you have to really step back and go like, what are the reasons why you would branch out, and how does that add value to your organization when you think about either your customers or your associates inside the organization? A lot of ideas about how we do the work inside our organizations comes from our employee resource groups. We use our employee resource groups in all different kinds of ways. One, to help us with culture and understand around how they are feeling included in the work that we do. We try products and services with our internal employee relations groups. We test services that we might be thinking about for our members with our employee resource groups. It really depends on what you are actually focusing on as it relates to what you need to mature. I think it's important to always make sure that inside you have a real clear understanding and your leadership has a real clear understanding is what you are trying to accomplish with your diversity, equity, and inclusion goals. I think the only other place I would say that is probably really important to think about moving externally is from a supplier diversity perspective. There is so much that a company can actually provide back to the community through supplier diversity. And there's so much you can learn by having suppliers that are from all walks of experience. So those are two areas where I would say it's a good way to focus internally and externally kind of at the same time.
Thank you so much. So at this time, in the interest of time, I'll turn the program back over to Colette to wrap up the program. Sorry, let me look to see if there's anything else. Whoa.
I've been so mesmerized by what you guys have been talking about, and I am just delighted that the audience have been so engaged and paying such attention. This has been an incredible, forum, and I want to do more of these with you, Stephanie, because clearly people are hungry for this. And I know that we will plan a couple more to really address issues that are even in maybe as people return to work, what are some of the challenges health-wise that they may have that we should be looking at as individuals and collectively as a company. I would love to for us to plan out another forum like this. But I just got a really nice email from Quincy Miller. He says, "This was outstanding. Thank you for your leadership." He says, "I know that I am," where is that, Quincy? I was just reading Quincy's Q&A. He said he knows that he's biased, but he thought that this was definitely outstanding. So that's nice. For those of you who don't know who Quincy Miller is, he's the president of Eastern Bank, and he's also one of the founders, along with Stephanie Lovell from Blue Cross and Blue Shield, of the new Commonwealth Fund. So is there anything else that you guys would like to add before somebody says, "Well done, Blue Cross team, great job, proud to be connected to you"? So that sounds like it's a internal Blue Cross Blue Shield person. So that's really good. Anything else?
No, Colette, I would just say thank you again for allowing us to share
Yes.
the work that we are doing at the company, and just know that this is a journey.
Yes.
We're really early in the journey around health disparities, and but we are dogged about this work, from the CEO all the way down to the person who sits and receives your phone call when you might have a problem from a plan perspective. So it is really, really passionate work. It's amazing work, and it keeps me up every day. And I really enjoy working with the team that's on the call here today. So thank you for allowing us to share this story.
And thank you, Stephanie. I just want to tell you how proud I am of you and of Blue Cross and Blue Shield for the work that you guys do, because when people talk about, there are certain companies, when you talk about racial equity, diversity, and inclusion, that automatically pops to the top. And Blue Cross and Blue Shield has always been one of the 3 top companies. You know, you think about it, and I think that has a lot to do with Andrew's commitment and with your vision of how to really pull all the pieces together so that it's not just the HR, but it's also how it impacts the business. So I want to thank you for that. And I can't wait for our next forum because I know it's going to be phenomenal. So thank you all.
Thanks.
And thank you to Christina, the woman behind the scenes. It's like, you know, the Wizard of Oz, the voice that you hear, but you don't see. Christina, come on, come on, come on. We want to see your face. Come on, so we can thank you for helping to make this really terrific. And I want to thank Mark and Cedric and Maria, and again, you, Stephanie, and Rory. And I want to thank my team, you know, who are incredible, Noah and Lily and Mary Helen and Michael for making this possible. So thank you all. It takes a village, as we all know. So thank you.
Thanks, and have a great day, everyone.
Yes, have a good weekend too. Okay, bye-bye.
Bye-bye.